The broadcast is now starting. All attendees are in listen-only mode.
Good morning, thank you for joining us and welcome to this Make UK webinar in partnership with She Software. I'm Jenny and I'll be your moderator for the day. I've got a great session for you this morning where we've brought together Make UK and She Software's expertise to delve into the difficult task of action management. We are recording the webinar, so you will be able to review and share with others. Throughout the webinar, we've got some polling questions. Please do submit your responses to help you get the most out of the session. There is quite a lot of us online today as well, and we want to make sure you can get the most out of it. So we've got some time allocated at the end for questions. You can submit any questions that you have at any point using the chat box, and we'll put them to our experts at the end of the session. Now, I'm delighted to introduce our presenters. Chris Newson, Make UK's lead for health, safety and sustainability product development and delivery. Chris is a qualified mechanical engineer and a fellow of the Institute of Occupational Safety and Health. We also have Julian Taylor, Head of Solutions Architects at She Software. Julian manages a team across the UK who work closely with organisations to clearly map out their issues, challenges and objectives to identify how technology can support. He is a qualified, he's NEBOSH qualified and has worked within the health and safety sector for 20 years. And I'm now pleased to hand over to Chris to begin the session.
Thank you, Jenny. Welcome everyone to the webinar. So we're talking today about action management. So I just wanted to start at the very beginning and sort of set the understanding of everyone. So there's two things to think about here. First of all, action management, I'm sure we all appreciate it is important and a good thing to have. In fact, it is also a legal requirement. So what I mean by that is, as you can see here, we're talking about the HSE's interpretation of the law. So hopefully you all recognise that model. So that is from the HSE's guidance, HSG 65, which is an interpretation by the HSE of the Management Regulations 99. So it's their interpretation of the law. It's the Plan, Do, Check, Act model that everyone's probably familiar with. What I think is just important to think about here is if we look at the Act part of it, it talks here about reviewing performance and learning lessons. If we go into HSG 65, it says that action management and clearly closing out things that we discover need to be done is important. So it is a legal requirement. It is also important if you look at the HSE's intervention history over the last few years, there appears to be a recurring theme of companies deciding on actions, investigating things, deciding on actions, and then not closing those actions out for lots of reasons. If we just think the logic of that through, what we've then given the enforcement agency is, all the things we know we should have done, and then we've said we haven't done them. So that's a very difficult position to be in terms of dealing with a HSE or any external body. So closing actions out in that way is very important. So that's the basic look at the law. If we go on to talk about ISO 45001, again, a lot of you might be familiar with this. It starts with the simple Plan, Do, Check, Act model. And again, you'll see these areas of performance evaluation and then improvements, slightly different titles, but it means the same thing. Now, if we think about ISO 45001, it's an externally accredited standard. You will have to prove, if you want to get this standard, you will have to prove to an external body that you are doing what the standard says. Very simple. If we get into the detail of what the standard says, if we look at clause 10 improvement, it talks about the organisation shall determine opportunities for improvement. And then the bit in bold here, and implement necessary actions. So we know how audits work. You would have to prove to the accreditation body that you are A, identifying the right actions, and B, as important if not more, actually closing those actions out. If, again, in a similar way, if we've got lots of actions but we don't close them, then you can't really argue that you're meeting clause 10, which is about improvement. And for completeness, if we just mention 10.2, So this particularly, 10.1's general, 10.2 particularly looks at incident investigation or incident outputs. That could be near misses, it could be accidents, and it also looks at non-conformities, so actions from audits and inspections and that sort of thing. So, you can't, very simple to put, you can't get accredited to 45001 if you're not showing you've got good action management, but it is also a legal requirement. At that point, I'd like to pass back to Jenny for our first poll, if I could.
Thanks, Chris. Yes, so for our first poll, we would like you to answer the question, how effectively are health and safety actions managed in your organisation? Is it very well, all actions are monitored and completed, reasonably well with some actions being monitored and completed, or you feel that it's not well and where you have limited visibility of the action or their status? Just give a couple of more seconds just to give everybody a chance to vote. That's great. Thanks. Let's see what the results look like. So interestingly, here we've got way out in front with 59% saying that their actions are managed reasonably well, with some being monitored and completed. 22% saying not very well, with limited visibility of the action or their status, and just slightly behind with 19% say that their actions are managed very well, with all actions being monitored and completed. Is that what you'd expect to see, Chris?
Yeah, I think so, Jenny. I think from my point of view, going into lots of companies and visiting them, we do see a repeating trend of actions not being managed. So I'm not surprised that sort of, not well has got a good proportion there. The 59%, that I think that is a little surprising. Maybe we've got a small sample size. I think the thing to think about with that is, if actions are being managed reasonably well and you're happy that they're being closed out in what you think is a good timescale, I think the other question to ask is, how much effort is that taking? And we'll talk later on in the webinar about the effort required to make actions work. So it's good and it's refreshing to see that actions are being managed reasonably well. I think the other thing to say is it's again not surprising that not many people are saying that they're managed very well, and we can take from that all actions are closed out in the right time and so on. So yeah, not that surprising. I would have expected not well to be slightly higher, but again, as I say, it depends how much effort you're putting into it. Julian, have you got any thoughts on that?
Yeah, I think I'd probably sort of concur with the points that you're making there, Chris. I think what those poll results show us is that there's still an opportunity to improve. That's what it's sort of saying to me. I mean, our experience is very much aligned to the Make UK experiences, in that when we tend to visit potential new sort of partners and customers, when we talk about action management and we ask about how effectively people are dealing with it, often we get the kind of embarrassed chuckle because people recognise that actually it's something that they struggle with, and it does seem to be something that people universally struggle with. And we'll go into a bit more of the detail in a moment as to why that's happening.
Thanks, Julian. So just supporting what Julian said there, I think if we look at this sort of simple picture, now I'm sure everyone on the webinar has seen this before, and Pareto's law, if you like. But what I'm trying to portray here is that if we think about it honestly, we spend perhaps 80% of our effort and time, and therefore that equates to money, finding out what the actions are. So what I mean by that is carrying out an audit, doing an accident investigation, collecting a near miss, whatever it might be. But great majority of our effort is put into finding the action out or working it out. And that's, it's absolutely right to get that, to spend a good amount of time doing that. Most of our efforts there, that leaves only 20% of our effort actually put into closing the actions out. And I think certainly from my experience, that's where organisations struggle. So We've got to say, some organisations don't investigate accidents, don't investigate them all. Okay, you know, that's understood. But those that do spend a lot of time investigating, and then it seems a lot less time in actually making the actions work. Now, if we just think about what that means, then the accident investigation that you've just put a lot of people effort into and you spent a lot of time on really was a waste of time, because you're not doing anything about the actions that came out. If we want to think externally, it could be the audit that you've paid for. You know, if that's what it is. Again, you know, a lot of people's time and effort into that. Then there's the cost of paying for the audit itself. And it is not uncommon for us as an organisation to go into some of our member companies 12 months later for a review of an audit and find that none of the actions have been done. That is not uncommon. And really, that audit was therefore not a complete waste of time, but we've lost a lot of the effectiveness of it. So we put a lot of our effort into finding out the action. We don't seem to follow through the action management bit with the same effort, or not the same effectiveness anyway. So I'll pass over to Julian now to just talk about perhaps what some of the barriers are to what's holding us back.
Yeah, and again, just to sort of reaffirm what Chris is saying here, I had a conversation very recently with a large manufacturing organisation, and I was talking to the head of health and safety. They have sites across the UK. Their experiences absolutely reflect what Chris is saying. They would go and do an audit, they would raise the actions with the local site manager, go back 6 months later, and nothing's happened. So why is that happening? Let me just go back a step. Well, as the slide says, it talks about disparate systems. So what do we mean by disparate systems? Well, very simply, one of the big mistakes that a lot of organizations make is that they have multiple systems. And what they do is they separate the actions from the activity. So to illustrate that, if you think about the audit, so that's the theme, that's what I've just been talking about. People commonly will do the audit on Excel, or they'll do it on a Word document, but then they'll take the actions and they will distribute the actions using potentially something like email. So immediately what we've done is separated the two things, and when we go to interrogate that audit, it's very challenging for us to actually see the status of those actions and what's happening with them. So that's the first thing. Having multiple systems means that sometimes it's challenging for us to be able to actually effectively capture the detail and what's happening with that action. And we talk about status. So actually, is it being closed out, as Chris said, in a timely and effective manner? And it's very challenging if it's in email for us to do that, because email is not going to chase things up. It's not going to escalate things. It's not going to help us in that process of actually keeping things closed out. So for managers, supervisors, team leaders, actually it's very challenging for them to be able to see with their teams, where are we in terms of, are we effectively doing the things we say we're going to do when we said we were going to do them. So the final part of that is that actually if you stop and then think about your lives, if you're dealing with actions using systems like email, is that actually it becomes very, very time consuming to do it. So you have to go into your emails, you have to go and interrogate them, you have to look for responses. And actually, if we think about our lives as health and safety professionals, what we actually want to do is use that time for more proactive, positive interventions like coaching and education. So there's a real sort of knock-on benefit here if we can do these things more effectively. Now at that stage, what I'm going to do is just hand back to Jenny, and I believe we've got our second poll.
Thanks, Julian. Yes, we do indeed. So for our second poll, we would like you to tell us what are your most significant barriers to effective action management. And you can select more than one of these answers, so select all of those that apply to you. Is it an ability to capture actions, visibility of status, keeping on top of outstanding actions, the need to chase those who are responsible, and the time it takes to complete the actions? still lots of responses coming in, so we'll give a few more seconds to give everyone an opportunity to vote. Right, great stuff. Thanks. So let's see what the results look like. So, Julian, way out in front with 80% is the need to chase those responsible. Then the next ones are with 51% each are keeping on top of outstanding actions and the time to complete the actions. And then there's visibility of status with 29%, and the least significant barrier is the ability to capture actions with just 13%. Is that the kind of spread you'd expect?
It's absolutely the kind of spread I'd expect to see, Jenny. And again, if we just think about those results, actually what it means is that we're spending our time being administrators rather than health and safety professionals. We're just physically having to chase things up. And as I said a moment ago, that then does mean that actually it's diverting us from sort of more positive activity. So the poll absolutely reflects what myself and Chris see when we go out and we speak with health and safety professionals.
Yeah, I'd agree with that, particularly the keeping on top of outstanding actions and the need to chase those responsible. The keeping on top of actions bit, a lot of the time it's because that's in multiple, as you said earlier, Julian, multiple emails. Maybe it's in a spreadsheet, difficult to segregate. Maybe there's several different spreadsheets, and there's lots of people that need actioning. And you know, I've got lots of emails therefore to send out. So that is yeah, repeated in all the companies majority of the companies we go and see. And the need to chase people, well, you know, everyone's busy, of course, in most organizations. There is a need to chase people. It just is how effectively and how efficiently we can do that, I think. Yeah, so thank you for that.
So just sort of to just sort of, I suppose, continue with that theme of time. One of our sort of marketing themes has been around get your Friday back, and what we're talking about here is the efficiencies that you can drive through a system, primarily around being able to sort of more effectively and easily generate reports. So that's a massive time saver for a lot of health and safety professionals. But this aligns absolutely perfectly to the theme that we've got today, which is if you think about the time that you spend chasing people up to ensure that things have been closed out, the time to interrogate systems to see the status of actions, actually that's a lot of time that we can then save for the health and safety professional, which they can use to focus on other health and safety KPIs or objectives that you've set yourself as an organisation. And I know Chris has got some more thoughts on this area.
Yeah, thanks, Julian. So I just thought it was interesting to share a bit of an actual story from a recent consultancy visit we had. So the quote that you can see in front of you on the screen is actually something that a visit that I was on that a health and safety manager said to me. So we were questioning and looking into the management system in general, and then we specifically started talking about actions. And she actually said that, you know, my system's great because I built it, and so on. So we looked into, yeah, okay, what do you mean by it's great? Well, actions get closed out. That's, you know, they're well managed. Okay, but how much effort does that take you? And what became apparent, and why you can see that picture on the screen in front of you, a couple of things. The health and safety manager here would receive lots of data from an inspection, from an audit, from a risk assessment, from an external visit, whatever it might be. So, you know, a number of different external and internal sources coming in, usually via email. She would then transpose that into some actions. That would then get added to a spreadsheet that she kept. And yes, it was in a shared location, but that relied on people going to have a look at it. That was an extremely long list of actions, lots of different columns, and you know, you could filter it, but long list of actions basically. And then what would happen is that she would, as I say, share that. The actions wouldn't happen. So the next thing to do is to email people. So the health and safety manager here would spend a lot of time emailing people about what their actions were, reminding them that, you know, they had a couple of days left till the due date, then reminding them that they were overdue. Eventually, she would have to go and see them and in many cases explain to them why they should do it, and it got done. In some cases, either she would end up doing the action or it wouldn't get done. And so while we sort of look at that and say, okay, actions are getting done, it's a great system, it's not really, because the amount of time it took that health and safety manager to do that job, it made it the main part of her role. And so I said something along the lines of, well, you know, so the main part of your job, you know, seems to be administering this action management system. And she's a diploma qualified health and safety professional. And she said, yeah, that's the main part of my job, you know, managing actions, getting things done. And, you know, I think in an organization, if you've got a qualified health and safety practitioner, you don't actually want that to be the main part of their job. I think the other thing as well is that a lot of, with these systems, people have developed them. Okay, so there's some pride involved there. So that's the other, sometimes people like the systems because they are at the center of them, but, you know, that's not an efficient way to manage things. So if we look at perhaps how to improve action management and what I think your health and safety manager should really be doing, is we start to talk about influencing people. So this is the real value add of your health and safety practitioner, or maybe that's you, that a lot of time and money has been spent qualifying you. This is what we think you should be doing, some of what you should be doing. So it's about influencing people. So if we talk about senior management, what do they need to help them make the right decisions? Well, you know, they need good data. They need to know not just how many accidents they had last year, but what's the trend, what's the problem areas, you know, what are audits telling them in a quick and easy sort of understandable format. And so, you know, there are many different ways of doing that. The understanding of the implications of that data, that again is what the health and safety professional should be doing. We know that a lot of training for health and safety professionals is around, you know, influencing skills and understanding the law. Well, you know, let's let them do that job and explain to people what the implications of that data are. And ultimately, and maybe the most valuable thing for a health and safety practitioner to do is offer a solution about what to do next. You know, maybe the law helps us, maybe the guidance helps us, but this is the real value add of a health and safety practitioner, not managing an Excel spreadsheet or whatever spreadsheet it might be. So that's senior management. I think it's important to think about as well what employees need. So employees need to understand the consequences for them. They need to be able to let management know if there's an issue, whether it's a near miss or a hazard, whatever it might be. They need to be able to let them know that quickly and easily, because, you know, if things are complicated, they're not going to do them. Perhaps, you know, it takes too long. And most importantly, they need to know that they're listened to, actually. So there needs to be a good feedback mechanism once they've raised a point for them to actually, you know, hear about what's happening at that point. So the other thing that might help companies here, so get back their time and start influencing people and not be relying on spreadsheets, is a tool called Assure. So recently, Make UK have gone into a partnership with an organisation called She Software that Julian's from, that's with us today. And what we've tried to do here is make health and safety software, market-leading health and safety software, affordable to the average SME. Usually, with an SME, it's out of the budget range. So what we've tried to do is make it efficient. And so one of the things it does is help us to manage action. So Julian, can you perhaps just take us through a bit more on that?
Yeah, that would be great. I think this slide that Chris has finished on is really interesting, particularly when we think about our world, which is technology and software, and how we use that to manage health and safety. Because these are some of the less tangible benefits that you actually get from starting to use technology. So if we can present good information and make that freely available, it helps people to be leaders and managers because they can use that information effectively. But also we can get rid of this sort of black hole that employees sometimes experience, where they report things, they tell you about things, but feel like they're not listened to because they don't see any activity. So through action management, we can clearly demonstrate that we are doing things and we're improving things. So let's dive into the system. I'm not going to go into a sort of a full detailed demo today, but let's focus in on this area of actions. So Assure that Chris introduced is a modular health and safety management system. So it's got a range of modules. You can do a number of things around health and safety disciplines. Let's think about the themes we've had today, which is the need for people to be chasing actions up, the danger of multiple systems, which reduces our visibility, and also being able to show the HSE that we've got process. So the first thing is that if I dive into one of our modules, if I go into our risks module, I'll fire that up. What I've done is I've gone straight into our area for activity risk assessments. So here we can see a list of risk assessments, and I could go in and look at the detail behind these simply by clicking on any of the records. The first thing that we've got is immediate visibility of the actions relating to those actual risk assessments. So the star icon that you can see with the different colors denotes actions. So I can see for each of these risk assessments, I've got one action. So I can see the number of actions. The color of the star then tells me the status of those actions. So we have a star here with no color. So that tells me we've raised one action, and that action hasn't currently hit any trigger points for reminders yet. What we can do is that we can set or define at what point we want to start reminding people. So we think about that chasing up of people around actions. We can say, for example, we'd like all actions to be chased up 7 days before the due date. Once an action hits that trigger point, the color of the star will change. So if we're looking in the system, we can see straight away the status of the action. So I can see here that this action is being chased up, it's pending. What it will also do is it will email the recipient on a daily basis to prompt them and to remind them to get that thing done, to get it closed out. So again, we can show that we've got a process here and we've got a way that we're going to effectively move actions on. If the person who's received the action then has done what they need to do, they can mark it as completed. So the yellow color that you can see in this second record down tells me that this action has been completed. What we also want, and Chris mentioned this earlier, is we want a quality check at the end of the process, however. So actually we don't want people just to be able to close actions out to, for example, get them off their desk. So an action isn't completed until it comes back to the person who raised it, for them to be able to check what's been done and for them to give it a stamp of approval. Once that's been done, the color changes again and it changes to green. You're probably asking, okay, that's all sounds great. What happens if somebody doesn't complete it? So down below, we can see we've got this classic red color that denotes warning. So that tells me that we've got an action that's overdue. So once an action hits the completion date, if it's not closed out, it will go red. Really importantly at this point, when we think about that chasing up, it will also escalate it to the individual's line manager. And if the person is different, it will also go back to the person who raised the action in the first place. So we just know through the email notifications and the prompts what's happening with our actions. Now, if I dive into the action area, so I can click on any action or on the icon, and what it does is it shows me the actions. I can then go and interrogate and look at an individual action and look at the detail behind it. So again, as Chris said, when it comes to evidencing to people like auditors or the HSE, we can do that simply and easily. If I fire up the template or the screen that we would use to raise a new action, I'm not going to fill lots of fields out for you today, but more just talk through some principles. Very simple form to complete. We give an action a title and we give it a description. So we can tell people what it is that we want them to do. We've got a very simple field here called category. And this is a configurable list of different categories. And whilst it's very simple, it's a very powerful field, because once we start collecting this information, we can then start reporting on it. So that visibility that we've talked about, we can start to interrogate our actions by category. So if, for example, I want to see all of my non-conformances, I can start to see that, for example, in a dashboard chart. I can also interrogate using multiple different criteria. So I can see the category and then who the actions are for. And we can send actions to individuals, but also to multiple people. So if I give an example here, if we'd had a near miss at one of our sites, and actually we thought this could happen elsewhere in our organization, I could send an action to multiple supervisors at different locations, maybe to do a briefing at the start of their next shift. Each of my supervisors then has to close that action out. So again, it becomes very easy for us to get multiple things done by multiple people. When I go on down, we have the due date, which we would expect to see. An action is very ineffective if we don't have a due date. And what we can see is also the date rate. So that starts to allow us to sort of measure the time taken to close actions out across the organization. And we have our priority. So I can interrogate by category and by priority. And then, as you've seen a moment ago when we were talking through the different colors around status, we can look at status. So I could look at my high priority non-conformances that are currently overdue. Very simple and easy. And if we give that information to managers, it allows them to manage. The final bit, just to talk very briefly around here, is that when I create an action and I save it, it will email out to the recipient. But I can also add attachments. So if I want our supervisors to do this briefing tomorrow, I could add a copy of the briefing to the action, and that will go out with the email when I save it and close it. So very simple and easy to create and to then send out to recipients. So in terms of actions, that's how we would create them. That's how we would see them within the system. But also when we're talking about visibility, we've got a really powerful tool here called Insights. And Insights, very simply, is a dashboard. So if I go back up to the top of here, let me just change a few filters. Bear with me for 1 second. This is a business intelligence tool that sits within Assure. So it allows us to interrogate and to look at all of our actions across the entire organization. So right at the top here, you can see that we can build filters to look at actions by individuals. If I scroll on through the charts, I can see the number of actions that we've got and the average time to complete. And then I can start to see things like actions by category. So that powerful category field that we saw a moment ago, this is the way that it can then be visualized. So very quickly and easily, we can start to see where the majority of our actions are occurring, and we can start to compare them by status. It's really easy to drill into the data then. So if I select an area, so if I just left click on preventative action, what it will do is it will refresh the entire dashboard, and now I'm just looking at preventative actions, and we can see where they're happening in the system and who they're for. If I click on it again, it goes back to all of our different categories. But also, if I right click, I can then drill into this using any criteria. And what I mean by that is any of the fields that we've got within the system, I can compare these actions to that particular sort of data field. So for example, I might want to say, okay, these preventative actions, who are they for? So here I've previously looked at it, so it's already there. So if I click on for user, I can see actually who all those preventative actions are for. So in terms of management, it's very easy for us to take that data and actually look at it in a very simple and easy way and then say, right, where do I need to focus my time and my effort? We can see actions by status and by priority. I really like this particular chart, which is overdue actions by category. So again, if I want to look at my preventative actions and just look at the overdue ones, if I click on that bar in the chart, it refreshes the entire dashboard just to look at that information. And then to close the loop, what we might want to do is say, okay, great, I can see all of this on the screen, but actually I then want to sort of revisit and go back to the records that it relates to so I can get a better understanding. So at the bottom here, this will show in terms of anything that I've drilled into, the records that are driving that visualization. And on the left-hand side here, we have link to record. So if I simply click on that, it takes me back to the record in Assure and allows me to look through the detail before I go and discuss it with the individuals concerned. So very simple and easy for us to be able to create actions. The system then does that chasing up for us, freeing up our time to do other more proactive activities. It takes us away from having multiple systems, and we can see all of our actions in one place. We have a process which we can demonstrate to external auditing bodies, but then we've got this overview, this visualization that enables us to lead, and also we can share that information with employees so that actually we can clearly demonstrate that we're reacting to the things that they're telling us about. Now at that point, I'm going to hand back to Chris to sort of summarize our discussions, and then we'll hand back to Jenny for any questions that have been raised.
Thanks, Julian. So hopefully you can see from just looking at that system, to summarize, if we can get a better way to manage actions and make that more efficient, then we can focus on the things that are really important in health and safety. So we talked about our health and safety managers influencing people to close actions. And I thought it was just important to reflect at the very end of this webinar about why this is really important. This is data on the screen that everyone's seen before, I'm sure, in many different formats. What it's telling us, as we all know, I'm sure, is that over a period of time, in this case, 18 years, and it's been going on a lot longer than this, there's a downward trend in accidents happening. And there's a similar chart for fatalities or for non-fatal injuries. The picture is similar. We know as well that there is a gap at the end. We're not at zero. People are still getting hurt in the UK on a very, very regular basis. And I think most people appreciate that. And what we often think about here, this gap between where we are and zero, is a lot around behaviour. In other words, we're dealing with people, therefore they don't always do what they're told. So, that's not news to anyone, I wouldn't imagine. What is also important to just think about is that a lot of that gap there is also about closing actions. Remember what we talked about earlier in the webinar, that we get a lot of good actions, we spend a lot of time investigating stuff, but then we don't action them. And it is a repeating trend with the HSE. If you read the details of some of their prosecutions, that, this accident happened here 12 months ago, 6 months ago, actions were decided, but they're not closed out. And that's with very serious accidents, and it's with more sort of regular contraventions of the law, if you like. So it really is a trend. We've done the hard work, we've worked out what the actions are, what needs to happen. Let's close it out efficiently, and therefore then close this gap and drive us somewhere down towards zero. The other sort of side benefit with that is, if we have a company that manages actions very well, it actually starts to impact the other thing here, which is around behaviour. If we think about that, the culture of an organisation may be that, well, I report lots of things and nothing ever happens, therefore I'm going to give up reporting stuff. That's a familiar story. But if we can change that culture into A, reporting things is really easy, and B, we definitely will close it out or get back to you, or both, then we can sort of develop this positive health and safety culture. So those two things together will close this gap that we've got. Okay, thank you very much for listening. I'll go back to Jenny at this point to see if we've got any questions.
Thanks, Chris. Yes, we do indeed. So we have a few moments left for questions. There's been a few come in that are asking about the cost of the software and how it works. I think the important thing there is we will get back to you on a one-to-one basis around that. What's really exciting about what Chris and Julian have been doing together is to build a bespoke version of the Assure software that is for an SME, and so we've made it affordable for an SME as well as retaining that the power and the impact that the software can have. For if you're a larger business and or you've got more complex risks, then it's quite likely that we might need to look at building you a bespoke version of the software. So we will get back to you directly on that following the session. So some other questions that have came in. So our first question is, how can we get senior leaders to drive the actions within their areas?
Really, really good question, Jenny. And I think a lot of it goes back to just presenting good information to people. So what we want to do is move away from the sort of traditional situation where senior leadership in an organisation was given a report once a month and it was generally about incident statistics, to one where we can present information on a daily basis in dashboards. You saw the sort of simplicity and clarity of that information just a moment ago. And actually, if we give people good, simple information and they have it on a frequent basis, it enables them to have more conversations and to prompt and to sort of coach the different teams across their sort of area of responsibility around the closeout of actions. So I think it all comes down to giving people good information.
Yeah, and I just add to that, Julian. You know, this how do we get senior leaders involved? The other important point to focus on there is that earlier on we talked about 45,001. You know, we shouldn't forget that clause 5 of 45,001 is all about leadership. So it demands really that the leaders, senior leaders, take an active role and in the action in health and safety management, and therefore action management as well. And this system, as you said, makes those actions and getting involved in those actions crystal clear, and you know, it's updated instantly so people can look at it. So it's a very tangible way of meeting clause 5 as well, if we want to look at that.
Great. Yep.
Thanks, Chris. We'll stick with 45,001 while we're there. And so questions came in about what evidence is needed for action management for 45,001.
Okay, so very simply, I mean, lots of companies have different systems. Very simply, the accreditation body will be looking at a couple of different stages. Number one, that you have identified actions. So if you've had an accident, they will want to see actions identified. They'll want to see that you've made it easy for people to report things like hazards and near misses, and indeed accidents themselves. And most importantly, perhaps, they'll want to see evidence that you've closed things out in a timely fashion. They're not going to tell you what a timely fashion is, but you know, whatever you've said, perhaps in your procedures and processes, is sensible. They will expect you to do that. They'll hold you to that. If you haven't stipulated a time, then they'll come up with what they think is reasonable. But yeah, I mean, it's straightforward. They want to see an action raised and it closed out in a timely manner. And I think this system just makes that easy. If we think about audits, you know, anyone that's been involved in an audit, there's usually some preparation goes into getting ready for these things. Well, if you've got this system, it's already done, it's already there. So, you know, it again saves you lots of time.
I think if you flip that as well, Chris, if you think about trying to evidence to the HSE that you've been dealing with actions effectively and you've been doing it through email, actually that's a really challenging thing to be able to do. So again, think about how simple this makes it in terms of being able to say, there are actions, this is when they were raised, this is when they were closed out, and this is what was done. And it's all about trying to just simplify things.
Thanks, boss. That's great. So unfortunately, we have run out of time, so that brings the session to a close. So thank you to Chris and thank you to Julian. We hope it's been valuable for you. As we've mentioned a couple of times, this webinar is part of our new partnership with She Software, where we've joined forces to bring together our expertise and the consultant and support that we deliver, and integrated that with She Software's Assure system. As I mentioned, we've got a solution that's specifically for small and medium businesses, and then one for a larger business as well. If you'd like to know more, then we've got some very brief survey at the end. If you'd like to know more, then just let us know in that survey, and we will get back to you and have a chat about your needs and see how the partnership will be able to fit and support you. We have some events coming up that you might be interested in. So our HSCE briefings are running throughout October and November. These events provide an update on key developments across health, safety and environmental management, and you can find out more on our website, makeuk.org. If you are attending the IOSH conference next week in Birmingham, you can come along and see myself and Chris at stand 31, and you can also go and talk to She Software at stand 5. She Software are also going to be at the IOSH Food and Drink Conference at stands 10 and 11, and Health and Safety North at stand K32. And you can keep up to date with Make UK, She Software, and any news on the partnership by connecting with us on Twitter and LinkedIn, and of course at both of our websites. And so once again, thank you very much for joining us this morning. The recording of the webinar will be circulated in the next day or so. And if you do have any further questions, please feel free to contact Chris or Julian directly. Thanks again. Hope to see you again soon.